So we have brought you a new case here. So the case says that a 22-year-old man has a reduced level of consciousness and affects dilated pupil. So the question is, what nerve is affected? So let's discuss the options now. So on seeing the options, we can first rule out cerebral or frontal lobe. So why? So let's take a look here in the side. So you literally have your brain. So this is your frontal, parietal, occipital and your temporal lobe. So as you know very well, your frontal lobe helps in your motor functions. What about your parietal? It helps in your sensory functions. What about your occipital? It helps in your vision. And finally, for the temporal, it is for hearing. So, if there is a motor deficit, it can present as a loss of movement. What else? It can present as a paresis or paralysis. It can also affect speech because your Broca's area is located in your frontal lobe, isn't it? So when you say the word paresis, what is it? It means it is a partial loss of movement. And when you say paralysis, it is a complete loss of movement. So are we clear with it? Let's move on to the next one. So we have the cranial nerve number 7. So what is cranial nerve number 7 again? It is your facial nerve, right? So what is the function of your facial nerve? It supplies your muscles, that is your facial muscles. Thus, the main function could be controlling your facial expressions, and it also supplies the tongue, so it can actually help in your taste. What about cranial nerve number 2? What is cranial number 2 for? It is your optic nerve, right? So it helps in your vision. And cranial nerve number 3, it is your oculomotor nerve. So the main function of oculomotor nerve, it can actually supply your extraocular muscles. So what are your extraocular muscles? It is your medial rectus, lateral rectus, superior rectus, inferior rectus, superior oblique, and your inferior oblique. So out of this, your LR or your lateral rectus is supplied by cranial nerve number 6, and your superior oblique is supplied by your cranial nerve number 4, that's your trochlear. So what is 6 again? It's abducens. So all other nerves, that's your medial rectus, superior rectus, your inferior rectus and inferior oblique, everything is supplied by your cranial nerve number 3, that is your oculomotor nerve. The second function is it actually supplies your levator palpebrae superioris muscle. So this specific muscle helps in the elevation of your eyelids. So what is the third? So the third muscle is your circular muscles. It actually helps in constricting and dilating the pupil in response to the light. So when there is a light, it actually constricts and also dilates the pupil. So, based on the discussion, I think everyone might have already had the answer here. So, the answer here is cranial nerve number 3 because it supplies the circular muscles, right? So, if this is affected, then there is some problem with here, and so affecting the dilation or the constriction of pupil, thus there is a fixed dilated pupil. Are we clear? If you have any doubts, you can post in our comment section, or you can follow us on MedXV Instagram, MedXV official.